I'm here with Barbie Robinson, the Director of our Public Health Department, Mark Sloan, Emergency Management Coordinator, and Dr. Peter Hotez. I'll speak, then Dr. Hotez will speak, and we're all available for questions. Tomorrow we cross day 500 of our COVID-19 disaster declaration. And today we find ourselves in the midst of not just one pandemic, but two. The first pandemic is the COVID-19 pandemic, which all of us are familiar with. Thousands of lives lost, our economy on its heels, but also the arrival of miracle vaccines that have proven effective and safe, that are readily available and free, that is keeping residents from dying at the hands of this virus. We're also in the midst of another pandemic, and that's a pandemic of misinformation. Misinformation that is keeping us from moving beyond this virus. I'll address that in a minute. First, I want to provide an update on where we are when it comes to COVID-19 in our community. Over the past few weeks, the region has been hit hard by the arrival of the Delta variant. The CDC estimates that the Delta variant, as of July 17th, comprises over 84% of COVID cases in the region our state is a part of. The results are very, very concerning. Cases, positivity rates, hospitalization rates are increasing, and the rates are speeding up. Our positivity rate, for example, our positivity is doubling every 2.3 weeks, which is faster than at every point during the last wave of the disease in December. During that wave, around 3,500 people lost their lives to this virus right here in Harris County. The ICU population is doubling every 4.8 weeks. That is almost as fast as the fastest rate during that same third wave. Now we're starting from a lower starting point, but everybody knows that when you see this kind of acceleration, you very, very quickly get to concerning numbers. Even if the peak is lower than past waves, simply having a long wave will lead to untold illness and death. Our first wave, which had a higher peak in July, saw around 2,500 deaths. The third wave in December saw about 3,500 deaths, even though it had a lower peak, just because it was a wider impact. Over half of our eligible population has gotten the vaccine. And that helps us keep cases and hospitalizations low amongst them. But we also have a variant that is a lot more transmissible. And the unvaccinated are interacting as though they were vaccinated. So basically what we have is a deadly tension between the spread of the variant and the vaccination rate. The Texas Medical Center has noted that around 90% of COVID patients there are not vaccinated. Most breakthrough cases are Delta variants, and we're seeing similar rates in our Harris Health system. In response to all of this today, I've directed the county to raise its threat level from yellow to orange. What does this mean? It means that there is now a significant and uncontrolled level of COVID-19 in Harris County. There's ongoing transmission of the virus. At yellow, we were seeing a moderate but controlled spread as the COVID-19 load in our community was steadily declining. At this level, at orange, unvaccinated residents should minimize contact with others, avoid any medium or large gatherings, and only visit businesses that follow public health guidance. We're now seeing two Harris counties. One Harris County that's fully vaccinated, protected, doing its part to get our economy running, and doing its part to protect those who cannot get vaccinated. Unfortunately, we're also seeing another Harris County that's hesitant to take action. It's okay to be a victim of this virus, but it's not okay to be an enabler. My fear is that much of that is due to misinformation online misinformation elsewhere. And no one knows that better than Dr. Hotez. We're doing our part to get the word out. Media campaigns, going door to door, offering incentives for vaccines, vaccines on demand, at a moment's notice, transporting folks to vaccination sites, hundreds of vaccination events, including in dozens of schools. It's natural to have questions. It's okay to be hesitant at first, but there is no shortage of credible information from health experts that point vaccines that are safe, that the vaccines are effective, and that we need to get the vaccines to get through this virus. Unchecked Facebook posts should not drive public health decisions. So I'd like to plead with our residents, yes, do your research, yes, read up using credible sources, but the time to take action is now. I also want to send a message to those who've taken the smart and patriotic decision to get vaccinated. You are the most trustworthy person in someone else's life. Commit yourself to engaging those around you who are eligible and who haven't been vaccinated to take action. It's not too late, but if we don't act now, it will be too late for many people. Over the past few months, we've watched with pride as the COVID-19 numbers decreased, and that was not by accident. Thousands and millions of people, well over 2 million people in this county, got their vaccine. You take that step. You made that sacrifice. You've taken steps every time we've needed you. And now I need you to wear your mask again. Our numbers are increasing so sharply again because of those who have not gotten their vaccine. But to the extent those of us who have gotten our vaccine take our mask off right now while the situation worsens, we're normalizing not wearing masks for even those who are unvaccinated. And so, as we have such a high spread, we're asking everybody to wear masks. If you have the vaccine with such a high level of spread, you could also be transmitting it to somebody who's not vaccinated, or somebody who can't get the vaccine. So I know they're uncomfortable. I don't like wearing masks either. But until we get the numbers back down, let's all wear our masks again. If you're fully vaccinated, you should know you're okay to continue activities and travel, but help us out with the masks. The bottom line for everyone is that you need to increase your vigilance. Pay closer attention to your interactions with others, and most importantly, help us spread the word about vaccines. Recognize that we're at the beginning of a potentially very dangerous fourth wave of this pandemic. Mañana cruzaremos el día número 500 de nuestra declaración de desastre del COVID-19. Hoy estamos en medio de no solo una pandemia, sino dos. La primera pandemia es la pandemia del COVID-19 que ya todos conocemos. Miles de vidas perdidas en este condado, la economía impactada, pero también la llegada de una vacuna, casi un milagro, una vacuna eficaz, una vacuna gratuita, una vacuna segura que está protegiendo a muchas personas. Pero también estamos en medio de otra pandemia, una pandemia de falta de información falsa en cuanto al COVID-19. Hablaré de eso en un momento, pero primero quiero hablar acerca de lo que estamos viendo en cuanto al virus en la comunidad. Durante las últimas semanas, nuestra región se ha visto muy impactada por la llegada de la variante Delta. Los resultados son muy preocupantes. Los casos, la tasa de positividad, las hospitalizaciones, todas están incrementando. Esas tasas de incremento están acelerando. En este momento, por ejemplo, nuestra tasa de positividad o la positividad en sí se dobla cada 2.3 semanas. Esa tasa de incremento es más rápida de lo que fue durante la tercera ola del COVID-19 en diciembre. Durante esa tercera ola, más de 3.500 personas perdieron sus vidas por el virus aquí en el condado Harris. La población de las UCIs se está doblando cada 4.8 semanas. Esa es casi la misma velocidad de lo que estábamos viendo en el peor momento de esa tercera ola en diciembre. La mitad de la población que es elegible ya se ha puesto la vacuna aquí en el condado. Eso ayuda a que esas personas no terminen hospitalizadas y no mueran a manos del virus. Pero también tenemos una variante que es mucho más contagiosa y aquellas personas que no se han puesto la vacuna están interactuando como si sí la tuvieran. Entonces estamos en una tensión mortal entre la transmisión de la variante Delta y la tasa de vacunación. La CDC estima que la variante Delta es un 84% de los casos en nuestra región. El centro médico ha visto que alrededor del 90% de los pacientes de COVID que tienen no se han vacunado y estamos viendo algo similar en nuestro sistema de salud público, entonces sabemos que las vacunas funcionan. Dado todo esto que vemos, el día de hoy he dirigido al condado que eleve el nivel de amenaza de amarillo a naranja. ¿Qué significa esto? Significa que ahora tenemos un nivel significativo y no controlado del COVID-19. Significa que hay transmisión continua del virus. En amarillo estamos viendo un nivel controlado del virus, ya que está consistentemente bajando los números, las hospitalizaciones, la tasa de positividad. Hoy día, los residentes que no se han puesto la vacuna deben minimizar contacto con otros, evitar reuniones medianas o grandes, solo visitar negocios permisibles que sigan las pautas de salud pública. Estamos viendo dos condados en este momento. Un condado Harris que está completamente vacunado, protegido, que están poniendo de su parte para reanudar la economía al 100% y a toda velocidad. Además, también que están protegiendo a aquellos que no se han puesto la vacuna. Desafortunadamente, también vemos un segundo condado Harris, que sigue dudoso de tomar acción. Está bien ser víctima de este virus, pero no está bien ser un habilitador. Mi preocupación es que esas personas que no se han puesto la vacuna lo están haciendo por información falsa, especialmente información falsa que existe por internet. Estamos poniendo de nuestra parte para correr la voz, campañas de medios, ir de puerta a puerta, estamos ofreciendo incentivos, yendo a docenas de escuelas, cientos de centros comunitarios y áreas alrededor del condado, pero necesitamos que todos pongan de su parte. Es normal tener preguntas, es normal estar dudoso un poco al principio, pero no hay falta de información creíble de los expertos de salud, que estas vacunas son seguras y efectivas. La información en Facebook no debe dirigir decisiones de salud pública. Entonces, les pido a los residentes y les suplico, sí, hagan sus investigaciones, hagan preguntas, lean fuentes de información oficiales, pero después de eso, tome acción. Es hora de tomar acción. Si no lo hacemos en este momento, podría ser muy tarde para muchas personas que van a terminar en el hospital o peor. También le quiero enviar un mensaje a aquellos que ya han tomado la decisión patriótica, inteligente de vacunarse. Usted es la persona más creíble y confiable en la vida de otra persona. Entonces, haga un esfuerzo para hablar con personas que en su vida que no se han vacunado para convencerlas de que se pongan la vacuna. Durante los últimos meses vimos esos números de COVID caer con orgullo. Eso no fue ningún accidente. Millones de personas en este condado se han puesto la vacuna y por eso llegamos allí. Ustedes han tomado ese paso, ustedes han hecho ese sacrificio. Cada vez que los hemos necesitado, han estado ahí a servir a la comunidad. Y en este momento les tengo que pedir otro favor. Los números están subiendo así de rápidamente porque aquellos que no tienen la vacuna están interactuando sin mascarillas, sin tapabocas, como si sí tuvieran la vacuna. Al nosotros, los vacunados, no utilizar la mascarilla, estamos de cierta manera haciendo normal el no utilizar la mascarilla. Estamos creando un incentivo para que aquellos que no tienen la vacuna también se quiten la mascarilla. Entonces les pido el favor que regresemos al uso de la mascarilla hasta que nuevamente el virus esté bajo control. Además, como hay tanta transmisión, aún una persona vacunada puede transmitirle el virus a alguien que no tenga la vacuna o que no pueda recibir la vacuna. A mí tampoco me gusta utilizar las mascarillas, son incómodas, no me gusta, pero hagámoslo en lo que volvemos a controlar la transmisión de este virus. Para todos les pido, aumente su vigilancia, sea consciente que estamos en una cuarta ola de este virus, que en la segunda ola murieron 2.500 personas, que en la tercera ola murieron 3.500 en este condado Harris. Pero la diferencia es que en esta ola tenemos una vacuna. No debe morir nadie más por este virus. Gracias. Thank you so much. We'll hear from Dr. Hotez and then we'll take questions. Dr. Hotez, thank you for your leadership and advocacy on this issue and, of course, your work to make vaccines possible. Thank you for joining us.
Well, thank you very much, Judge, and thank you for your leadership. And I mean that very sincerely. Throughout this whole pandemic here in Harris County, you've been evidence-based, and you've been timely and accurate, and you've really guided the county, Harris County, through this pandemic in an extraordinary way. And I completely agree with your decision to go to orange. It's absolutely warranted. And here's why. This Delta variant, I'd like to kind of structure my remarks first around the Delta variant itself, why we need to be concerned, then talk about where I think it will go in Harris County and in Houston. Next, talk a little bit about vaccines and how effective we expect them to be against the Delta variant, and then what we do about this very aggressive anti-vaccine disinformation in order to address that. So in terms of the Delta variant, this is far more transmissible than anything we've seen before. It's far more contagious. So if you remember, compared to the original lineage, the one from the United Kingdom, the B117 variant, was 50% more transmissible than the original one. This one, Delta, is 50% more transmissible than that. And what it means basically, we're dealing with this Delta variant that's twice as contagious as the original COVID-19 virus, the SARS coronavirus type 2. And that's why we're seeing this very aggressive spread in areas where vaccination rates are low. So it really began in southern Missouri, went into Arkansas, Louisiana, and because these are the places where vaccination rates are lowest in the country, it's now it's spread east into northern Florida. Now it's going up the seaboard into the Carolinas. So it's making a big circle, which is going to knock off also Harris County and Houston as well, and then it's going to start to fill in. So we are looking undoubtedly at a serious surge across the South this summer, which in some ways bears resemblance to what we saw last summer, with one important difference, I think. We've done a better job vaccinating older Americans, so the number of deaths will not be high. But unfortunately, we are going to see a lot of young adults, adolescents, and even kids get sick. And the big thing that worries me is, by now, anyone who's unvaccinated and has been lucky enough to escape COVID, your luck is about to run out. That's how transmissible this virus is. And so I think one of the messages for today is it's still not too late to get vaccinated. We are not doing very well here in Harris County as we could. We're doing better than other parts of the South, but compared to the Northeast, we're just not at that level. So let me give you an example. Up in the Northeast, in Vermont and Massachusetts, essentially all of the adults and all of the adolescents are vaccinated. What that means is it's likely that the Delta variant is not going to accelerate up in the Northeast because the they were successful in getting everybody vaccinated, and that will slow or halt transmission. Unfortunately, in many parts of the South, like Louisiana, where only 15% of the adolescents are vaccinated, maybe 30-40% of the young adults, this thing is just going to sweep through states like Louisiana. In Harris County, we're doing better than Louisiana, but not by a lot. So we've got about 44-45% of the whole population vaccinated. That's not great, and particularly among BIPOC communities, it's even lower than that. So my big worry is that we're going to really see Delta accelerate throughout the unvaccinated component of Harris County. And to give you an example, is as the judge mentioned, essentially all of the individuals hospitalized right now in our Texas Medical Center are unvaccinated. Easily over 95%, maybe getting up to 99%. And 99% of the deaths are among the unvaccinated. So, to put it bluntly, in very stark terms, essentially anyone who's hospitalized for COVID right now, pediatric hospitalizations aside, adult hospitalizations, anybody who's hospitalized or is in an ICU from COVID right now is there by choice, is there because they didn't make the effort to get vaccinated. And that's what we need to fix. You might ask, why is Delta variant so different from the others? We don't really know. There's a preliminary study out of southern China that suggests that this virus is more efficient at replicating, especially in our upper airways, maybe 1,000-fold more virus. So I think people are shedding a lot more virus, and that has a lot to do with the basis of transmission. So knowing that makes wearing masks all the more important if you're unvaccinated, and in any kind of indoor setting, you need to wear a mask if you're refusing to get vaccinated. But undoubtedly getting vaccinated is overwhelmingly the single best thing you can do for yourself and for your loved ones. And it's not too late. And remember, you don't have a lot of time, because if you get the 2-dose Moderna or Pfizer BioNTech vaccine, you need both doses to get a really robust immune response. So that means even if you get vaccinated today, you have to wait 3 to 4 weeks to get the second dose, and then you don't develop immunity till a week or two afterwards. And so it takes time. So now is the time to do it. There is no reason to wait. And, we're hearing tragic stories now from ICU nurses who, right before their patient is going to require intubation for COVID, they say, okay, I'll get vaccinated. No, it doesn't work that way. This has to be a preventative. You have to be vaccinated now in order to prevent you from getting COVID. Let's switch gears a little bit, and I'm happy to answer questions about what it means to be vaccinated in terms of the Delta variant. There's some good news. A paper came out in the New England Journal of Medicine last night suggesting that if you get 2 doses of the Pfizer-BioNTech vaccine, and it's likely going to be this hold up for the Moderna vaccine as well, because it's similar, they're both mRNA vaccines, the decline in efficacy against symptomatic illness is modest. So if you remember from the phase 3 trials, the 2 mRNA vaccines gave 95% protection against symptomatic illness. Now it's dropped to about 88%. So it's gone down a little bit, but still very robust. And in terms of serious illness and hospitalizations, it's close to 100%, or much better. So the good news is if you're vaccinated with those vaccines, you're unlikely to get sick. The questions I get asked a lot about, what about the single-dose J&J vaccine? We don't have those numbers. We have a small study done in the test tube suggesting the virus-neutralizing antibodies do go down compared to the original lineage, looking at the Delta variant. We don't really know what that means. That was true of the South African variant as well, and in terms of clinical correlation, it showed some decrease in effectiveness, but it was still pretty good. But what we're waiting for now is some guidance from the CDC and the FDA with the company, whether they might recommend a second immunization at some point. Right now, but you should feel relatively comfortable if you've gotten a single dose of the J&J vaccine. There's a possibility you may need a second dose at some point. We've not gotten that guidance yet. A couple of other things. And this gets a little complicated, and I don't know how much in the weeds you want to go into, because the question I'm asked is, okay, I get it, doc, about the symptomatic illness. The vaccines are really good. What about asymptomatic transmission? If I'm vaccinated, do I know that I won't pass the virus on to anybody else if I do get it? And that we just don't have the full complement of data, partly because this Delta variant is so new. We know it replicates in much higher amounts. And so the questions, because the reason the CDC made the recommendation that if you're indoors and if you're vaccinated, you no longer need a mask, that was based on hard data from Israel and the UK showing that the vaccinations also halted asymptomatic transmission around 90%. We don't know that with the Delta variant, and so we're waiting for that information as well. So until we have that information, given the fact that it replicates in higher amounts, what I'm doing now is, even though I'm vaccinated, I'm still wearing a mask indoors when I'm going indoors, like in this setting as well. I know I'm not going to get symptomatic illness because it's a good performer, but we don't know specifically about asymptomatic transmission. So it's kind of a subtle argument, and you may have a subtle discussion, and we may want to have some questions about that so we can clarify it a little bit more. We have to be careful, though, because we don't want to send the message that these vaccines are not working. They are. These vaccines will save your life and will save the lives of your loved ones. They'll keep you out of the hospital, keep you out of the ICU. The other big concern I have is young people, especially from all the anti-vaccine aggression that's out there, are getting the message, the false message, that if you're young and healthy, you take care of yourself and go to the gym, don't worry about getting vaccinated. You don't need it. It's not true. We absolutely, it's great to take care of yourself and have a proper diet, but it's no substitute for virus neutralizing antibodies. So what we're seeing now are a lot of young adults, adolescents going into the hospital absolutely shocked that they're sick from COVID and may have to be intubated or may require an ICU admission, because that message they've gotten is that they won't get sick from COVID-19. It's absolutely not true, and that's why almost all of the people hospitalized right now in the Texas Medical Center are younger people, younger adults, and also pediatric ICU hospitalization, so in terms of adolescents. So it's really critically important. We also don't know all the details about what's called long COVID, which is long-term neurologic, cardiovascular, and pulmonary symptoms such as shortness of breath or heart palpitations, or what people call brain fog, where they're just not functioning at the level they want to, or having prolonged headaches or even depression. We're seeing that as well. We're starting to learn more about the basis of that, but we are seeing it about young adults. About 26% of young adults who get infected are getting long COVID. And this is not a time of your life when you want to get long COVID, right? This is a time in your life when you're applying to universities, taking your SATs, or looking for your first job, or maybe getting married, maybe starting a family. This is not the time you want to get long COVID. Yet another reason to get vaccinated. So unfortunately, the anti-vaccine misinformation, which is really disinformation, deliberate intent, is dominating the internet. So right now, if you do internet searches, or if you're listening to the media, especially the conservative media, what you're seeing is a lot of inaccurate information that's saying all the things that we're talking about, that saying falsely that if you're young and healthy, you don't need a vaccine, or somehow that the vaccines are dangerous or they're rushed when they aren't. We started working on coronavirus vaccines 10 years ago, and all of the COVID vaccines that we have today build on our research and development that we've done at Texas Children's Hospital and Baylor College of Medicine. So these vaccines have gone through as rigorous a process as any vaccine that we've ever released to the public, and I'm happy to answer more detailed questions about that. So I don't want to go on too long, but those are some of the big highlights, and happy to take further questions or however you'd like to proceed, Judge.
Thank you. And we will take questions, but I was told that the pool audio wasn't working at the beginning, so I'll just briefly go over the top of the remarks, and then we'll move on to the question. And what I was pointing out is tomorrow is actually the 500th day of our COVID-19 disaster declaration. We're seeing two pandemics at this point, not just the COVID-19 pandemic that we're familiar with, but a pandemic of disinformation, where it is keeping folks from moving past this virus and the economy from really running in all cylinders. Over the past few weeks, our region has been hard hit by the arrival of the Delta variant. The CDC estimates that the Delta variant comprises over 84% of COVID cases in the region. That includes Harris County. Cases, positivity rates, and hospitalization rates are all increasing and are all accelerating. The positivity rate is doubling every 2.3 weeks, which is faster than at every point during the past wave of the vaccine in December, where 3,500 Harris County residents lost their lives to COVID-19. The ICU population is doubling every 4.8 weeks. That is almost as fast as the fastest rate over the last wave, that same third wave. And we had huge numbers of hospitalized. Then we had huge numbers of hospitalized during the second wave in July. And if we don't bring the cases down now, we're going to see those similar results of many, many people going to the hospital and people dying unnecessarily. We're in a deadly tension between the spread of the Delta variant and vaccination rates. And that's why we need folks to get vaccinated. In response to this data, today I am directing the county to raise its threat level from threat level yellow to threat level orange. That means there's now significant and uncontrolled level of COVID-19 in Harris County. At yellow, we were seeing moderate but controlled level of COVID-19. We were seeing all of our trends improve because of the work everybody did. At this level, we need unvaccinated residents to minimize contact with others, to avoid any medium and large gatherings, to only visit businesses that follow public health guidance, and most importantly, to get vaccinated. That should be the pieces that the pool missed, correct?
Yeah.
Any questions?
You talked about all the things that the county's done to make the vaccine as easy as possible. I think that's touched on this a little bit, but who is not getting the vaccine? Why aren't they doing it? And why do you think that message is not getting through? How do you break through that?
Right now, about 50% of the total population has gotten the vaccine. If we look at the eligible population, there's around a 40% of the eligible population that's not getting vaccinated. And the largest part of that is disinformation. It's this mistrust and folks spreading false rumors about the virus. We're seeing higher rates of unvaccinated amongst the African American community, followed by the Hispanic community here in Harris County, but really all communities have residents that are just unwilling to get the vaccine. And so that is what, the limited research that's out there tells us that the most persuasive approach for these folks that are unvaccinated is somebody they trust, telling them, explaining the research, the vaccine is safe and effective. We're going to continue doing everything we can. We're in communication with other jurisdictions to share what other ideas they have to make the vaccine even more accessible. But there's not very much else we can do as government. We need individuals to recognize that they're moving from a point of hesitancy to a point of enabling this virus, enabling these hospitalizations, and enabling these deaths. And so we have got to draw a line there on enabling, and people who are not getting the vaccine need to go and get it.
On that note, people making that decision. Yesterday, I asked Governor Abbott about requiring masks in schools. He told me, quote, "We're past the time of government mandates. We're into the time for personal responsibility." Do you agree with this statement that this is more about personal responsibility at this point, or if not, what tool, what mandates, what do you believe the government needs to do basically to try to bring these members down?
what we've been past from the very beginning is a time of political back and forth, and so I don't want to get into that. What I will say, from the beginning, we've seen it. When there have been mask requirements, people wear the mask. When there's not a requirement, people don't wear it. That's why there's seatbelt requirements. That's why there's fines for parking in a handicap spot. Realistically, right now, I'm not able to require masks, and so the best that I can do is plead with the community. Plead with the community. I know there are many people in this community, perhaps the majority of the community, that has been extremely responsible. Yes, we've seen thousands and thousands of deaths, but we haven't seen our hospitals overwhelmed like they have been in other large counties because of the actions of responsible, patriotic people in the community. So I ask that those same people help us out again, wearing the mask, and everybody else that they get their vaccine. Very, very concerned about schools starting out without masks, and so, but the best I can do is be very, very clear in my messaging, and I'm doing all I possibly can to do the job I'm elected to do, which is to protect our community. I don't have all the tools at my disposal that I did, but I'm using every tool I do have.
If I could add also, I am concerned about, school in Houston and this part of the country is going to open in a few weeks, and we're not doing as well with vaccination rates as we'd like. So, if you're up in the Northeast, where all of the adults and just about all of the adolescents are vaccinated, I can pretty much guarantee it's going to be a very successful fall semester. We're not as fortunate down here because of the lower rates of adolescents and young adults and faculty and teachers that are vaccinated. So what do? Well, all you really have left are masks. So it's going to be really important for elementary, middle schools, even high schools to wear a mask if those vaccination rates don't come up very soon. It's not too late. If you choose to get vaccinated now, you can still be fully vaccinated by the time the school year starts, and that may be the most impactful thing you can do as a parent or as an adolescent to protect yourself and your family.
En español, Lina, ¿es posible implementar nuevamente el uso de mascarillas o simplemente puede pedir el favor? De alguna manera tiene las manos amarradas, ¿no?, en lo que puede implementar.
Así es, en una emergencia, desde el principio de esta pandemia, he querido evitar las luchas políticas, y eso es en lo que se ha convertido esto. Lo que sabemos con seguridad es que cuando han habido requerimientos de mascarillas, la gente utiliza las mascarillas. Cuando no hay requerimientos, la gente no las usa tanto. Es como el requerimiento de utilizar un cinturón de seguridad. Simplemente así es el comportamiento de una comunidad. Entonces, en este momento no tengo las herramientas que tenía al principio de la pandemia. Bajo las órdenes del gobernador no tengo esa opción de requerir mascarillas. Lo más que puedo hacer es rogar pues con todos el utilizarlas para poder nuevamente controlar el virus, y además también pedirle y rogarle a las personas que no se han vacunado que se pongan la vacuna. Ya estamos pasando un momento de duda a un momento de estar habilitando el virus, habilitando esas muertes y esas hospitalizaciones si usted no se ha puesto la vacuna. Entiendo que haya duda, entiendo que quiera buscar información. Hay suficiente información oficial muy disponible. Entonces, yo pues tengo la responsabilidad de proteger a esta comunidad. Estoy utilizando todas las herramientas a mi disposición, pero sí tengo las manos atadas por órdenes estatales que me prohíben requerir las mascarillas. Entonces, les pido de favor que lo hagamos nuevamente.
Y ahora el mensaje para negocios que tienen ellos la libertad, ¿no?, de implementar mascarillas en el negocio de ellos.
Sí, hay una población importante que nos puede ayudar muchísimo en este esfuerzo, y son los negocios. Como hemos dicho desde el principio, los negocios siempre pueden decir, no se entra si no hay camisas, si no hay zapatos, si no hay mascarillas. Entonces, si usted es un dueño de negocio, ayúdenos al requerir las mascarillas, proteja así a sus empleados, proteja así a sus clientes, pero también pues incentivar las vacunas. Incentivar las vacunas es lo que nos va a ayudar a vencer esta pandemia de una vez por todas.
Can you speak to, on a conference call?
I think you...
Oh, I'm sorry. What am I doing? Just speaking into this. Can you speak to, I guess, the lowered testing ability that the county has and how concerned you are about this going into this fourth wave, whether, especially given the closing of testing centers, or many of them?
Right now we have the testing capabilities to test all those who are seeking a test. Part of the reason I'm so focused on hospitalizations in this conversation and in the analyses that led us to make this decision is because the case counts have become quite erratic. Initially, there were so many people that needed a test and not enough tests. Then in December, we had both test availability and testing. Now in this fourth wave, what we're seeing is testing availability, but people not getting tested as much. And so if we see a strain on the testing capabilities of the county, it's very easy for us to ramp them up. It's good for people to get tested and know whether they have the virus, but we're in a different phase of the pandemic now. We have a vaccine. We have vaccines. So before you go take any other step, go get vaccinated.
We're also starting to realize that the presentation of COVID with Delta looks a little different from what we've seen in the past. We're seeing people present with more upper respiratory symptoms, almost like a cold, congestion, in addition to cough. So if you think you're getting a cold, you might think, hey, maybe this is COVID, and get tested as well. Now, that's going to create some disruption as the school year starts. As a parent of now 4 adult kids, when my kids were little and going to school, guess what? I probably had an upper respiratory infection more often than I didn't when my little kids were in school. So that we're going to have to manage that. The other presentation that we're seeing is diarrheal disease or gastrointestinal upset. So that's something to keep in mind also. So recognize that how COVID presents with the Delta variant may have some differences from what we've seen previously. Sorry.
Just a quick follow-up on my question earlier. Is a mask mandate something that you would, obviously you don't have the power now because of the state, but is that something that you would do at this point if you could, given the numbers? And have there been any conversations with the governor's office about maybe giving counties a little bit more power in this situation?
We have, from the very beginning, we were successful as a community various times in controlling this because of that us working together and having those clear orders, right? Not just a recommendation. And we saw that when the orders turned to recommendations, behavior changed almost overnight. So yes, in a situation where what you are risking is deaths, again, hundreds or thousands perhaps, well, we don't know, we just don't know. Certainly hospitalizations, again, in very high numbers, and it's entirely preventable. Of course, if I had the authority to do this, I would. It doesn't please me to do that. I don't like wearing a mask. I frankly thought that once we went to, yellow, that the next step would be green. And we knew there was that tension between the variant and vaccination rates. And unfortunately, right now, we're seeing that variant overtake the impact of the vaccination rates. So, I think all of us and the medical professionals have made very clear, the Association of Pediatrics, the dire need for masks as this virus begins accelerating. But again, I think we need to keep this discussion outside of the level of politics and political tension between the state and local level. The reality of the situation is I'm doing everything I can within the jurisdiction that I have right now.
Last question from the pool.
If you can answer in English and Spanish, just an update on the incident from yesterday.
Yes, so we have gotten information from Dow Chemical this morning that they were able to take a sample from the tanker truck that was at risk of causing a fire or explosion. And that sample came back that the material that is in there at the time is actually residual material. It is no longer active. It is no longer a threat. So that's the information we got from them. We don't know if perhaps the theory is that the reaction was taking place this whole time and it managed to fizzle itself out without causing a major issue. So now all of our first responders, fire marshal's office, emergency management team is working with Dow to really protect that tanker and try to move the other ones out of the way and eventually move that one out of the way. Do you have anything to add, Mark? Okay. And so, en español, hemos recibido información de Dow esta mañana que el tanque peligroso que estaba a riesgo de explotar o causar un incendio el día de ayer, fue posible tomar una muestra esta mañana y han determinado que el material dentro del tanque ya no es activo, es lo que nos dice Dow, es residuo del material que estuvo ahí en algún momento. Entonces la teoría es que esa reacción química estuvo llevándose a cabo de una manera pues, paulatina durante la noche y ya el riesgo es mucho más bajo. Entonces seguimos trabajando con Dow para poder proteger ese tanque por si cualquier cosa pudiera suceder y finalmente, después de que esté la situación más controlada, poder llevarlo a otro sitio. Thank you. Thank you, Dr. Lucas. Yeah.